It gives me great pleasure to introduce our keynote speaker, who is Dr. Sanjiv Chopra. And he's the kind of person, when you look at his CV, you don't even know where to start. And he's done so many things and been so distinguished at everything he's done. He is first and foremost a fantastic physician, clinician, gastroenterologist, and hepatologist. He joins us as a faculty member from Harvard Medical School, a longtime consultant at the Beth Israel Deaconess Hospital. He ran the CME program as the faculty dean for 12 years, I think, and it became the most robust CME program around the world, actually. He is a master clinician. He was honored as what's called the Marshall Wolf Clinician Educator at the Brigham and Women's Hospital, which is just for clinicians, kind of the doctor's doctor, the clinician's clinician. And his passion has been to teach and educate and to heal. He is also a best-selling author. Actually, I forgot to mention, he's the section editor of the editor-in-chief of the hepatology section of Up to Date, which we all read multiple times daily, probably millions and millions of hits over and over. But he is also a best-selling author, and he's written 10 books. He's an inspiring speaker. Last night at dinner, I was just constantly inspired, and I was constantly on my phone. It was just four of us in a very intimate setting. Paul Rubenstein had joined us, and Robert Wong, and I was just writing down all these little nuggets of wisdom and inspiration, and gave me a long list of books and TED Talks I need to read and watch. And so I'm very, very excited to have him come join us today to give the first of his two talks, and I think they're going to be amazing, amazing talks for us to learn a great deal from. Thank you, Sanjiv.
Thank you so very much for that very kind introduction. I'm delighted and honored to be in your midst and to talk about two topics. The first one is the top stories in medicine in the last century, and then to reflect on what I think will or may happen in the next 50 years. That's going to be a lot of fun talking about that. So a lot of the discoveries in medicine, the discovery of penicillin, the discovery of hepatitis B, were sheer serendipity. The word serendipity is from a book called The Three Princes of Serendip, whose heroes were always making discoveries by accidents and sagacity of things they were not in quest of. Louis Pasteur informed us, in the field of observation, chance favors only the prepared mind. The first story I'm going to talk about is the discovery of hepatitis B surface antigen, then called Australia antigen, by Baruch Blumberg. Dr. Blumberg was a geneticist. He was not a virologist, not a hepatologist, and he had an interest in the study of polymorphic serum proteins. E.B. Ford, an Oxford geneticist and zoologist, defined polymorphism as the occurrence in the natural habitat of two or more presumably inherited and discontinuous forms of his species in such proportions that the rarest of them cannot be maintained merely by recurrent mutation. And examples of polymorphism abound in human biology, the different hemoglobins, the different haptoglobins. And Dr. Blumberg one day found that the blood from an Australian Aboriginal cross-reacted with the blood of a patient in Philadelphia. He called it Australia antigen. He then published a paper in JAMA in 1965, together with Harvey Alter, one of the great virologists of our time. They discovered that this antigen, Australia antigen, was frequently present in patients with leukemia. He thought they'd figured out the cause of leukemia, or a virus, or a marker, entitled a new antigen in leukemic sera. In retrospect, these were leukemics who had been transfused, and some of them had come down with chronic hepatitis B surface antigenemia. He got the Nobel Prize in Literature or Physiology for this discovery. He had a technician by the name of Barbara Warner. She had tested herself for Australia antigen and she was negative. And one week she comes to work, she's not feeling well. And she tests herself again and she's positive. Turns out she has hepatitis. So he wrote to all the Philadelphia area physicians and said, every time you have a patient with jaundice, can you send me a sample of serum? And lo and behold, many of them were positive. And when they recovered, the test was negative. So that was a discovery of hepatitis B. It's told in a fascinating first-person account by Dr. Bloomberg in his acceptance speech for the Nobel Prize in Medicine, which he got in '76, and this was published in July '77 of Science. If you have some leisure time, I recommend you read it. So this is the actual hepatitis B virion. This is the Dane particle. The surface antigen is 22 nanometers. Dane particle is 42 nanometers. And we have viruses that exist in nature that are hepatotrophic, and they are DNA viruses, hence the term herpetoviruses. Now, sometimes the mode of transmission of hepatitis B can be very blatant, like in this colorful individual with this amazing tattoo. And unfortunately, he got saddled with chronic hepatitis B and developed primary liver cancer several decades later. But sometimes the mode of transmission is somewhat more arcane. And here's an example of that. This is a form of cross-country running, very common in the Scandinavian countries. They may have 10,000 people on a good sunny weekend take part in a race. 10 kilometers, checkpoints. The rest of the time you can choose whatever terrain you wish to. And at the end, they all bathe communally in stagnant pools of water. And over the next 6 months, this is called orienteering or needle tracking. Over the next 6 months, there's an outbreak of hepatitis B, because some of these participants are asymptomatic healthy carriers. And it's important for us to remember that it's often the asymptomatic so-called carrier, bad term, who has the highest replication of hepatitis B. So they get wounds, cuts, and they disseminate the hepatitis B at the end of the race when they're bathing communally in ponds. Now, in order to get the number 17, you have to get a doctor's certificate saying you don't have hepatitis B. And if you do, you can take part in the race, but you can't take part in what they consider the most fun part of the race. So worldwide burden, 400 million people afflicted with chronic hepatitis B. So one chronic liver condition in which we do not need the underlying presence of cirrhosis in order to get primary liver cancer. 30% of primary liver cancer that occurs in chronic Hep B patients occurs in the absence of cirrhosis. And here's an example of one of our own patients at the Beth Israel Deaconess Medical Center, non-cirrhotic, with an unresectable large primary liver cancer. The hepatitis B vaccine is truly the first anti-cancer vaccine. Prevalence of hepatitis B carrier state dropped in Taiwan from 15 to 20% to 1.5% with 2 decades of childhood vaccination. But more importantly, childhood hepatoma mortality in 2 decades decreased by 75%. The next story I'm going to talk about is that of cholera. Sushruta, 600 to 512 BC, was an Indian physician who advocated the C-section, removal of kidney stones, cataracts. He cataloged more than 100 types of surgical instruments. But he also wrote an excellent description of a disease resembling cholera in Sanskrit, in a major treatise of that time. This sage person stated, "May God be with me, may heaven bless this new year, may it be a year of fruitfulness, of peace and prosperity, may it be a year of peace and unity for all mankind. May the world be freed of cholera." So cholera, Malpighi said, is a disease that begins where other diseases end, with death. They have secretory diarrhea. They're putting out more than a liter of stool every hour. And unless they get oral rehydration therapy if they're awake, or intravenous resuscitation if they're moribund, they die. There were 2 seminal observations in the early 1960s. The first was discovery of the sodium glucose cotransport as the mechanism for intestinal glucose absorption. So if you give them oral hydration therapy and add a little bit of sugar, you can enhance the absorption. There is actually a program in Africa called Cola Life. Coca-Cola goes with these huge trucks to remote places, and they give them oral rehydration solution. And the other observation was that prior to this, it was thought that there's going to be abnormalities, pharmacological abnormalities, morphological abnormalities, when you do a small bowel biopsy. But in reality, the small bowel biopsy is completely normal. And the small bowel, even though it's putting out liters and liters of fluid, is capable of absorbing it. That discovery and initiation of oral rehydration solution therapy has saved more lives than all the antibiotics put together. Let me repeat that. Oral rehydration solution therapy for diarrhea around the world has saved more lives than all the antibiotics put together. This is Richard Cash. I knew Dr. Cash. He was a physician at Harvard School of Public Health. He did some seminal work in Bangladesh. And here's one patient with cholera, and he was moribund. He could not take in oral hydration, so he had to get intravenous resuscitation, and it required nearly 150 liters of fluid resuscitation for him to survive. In 2010, an earthquake occurred in Haiti. Cholera was unknown to Haiti. We believe it was a Peace Corps volunteer, a healthy carrier of cholera from Nepal, who gave and spread cholera to that country. More than 6% of Haitians were afflicted, more than 700,000 cases, and more than 8,000 deaths. But even more impressive is what's happened in Yemen. Devastation, a country ravished already by war, economic collapse, and near famine, suffers from this devastating cholera outbreak. More than 700,000 cases, with up to 7,000 new cases a day. This was reported in October of 2017. The third story I'm going to talk about is going to be about the first successful organ transplantation. This is a story about Boston. It's a story about what was then called the Peter Ben Brigham Hospital. I'm privileged to work there. It's now called the Brigham and Women's Hospital. So there were two identical twins, Richard and Roland Herrick. They were 23 years of age. Richard had end-stage kidney disease. They walk into Dr. Murray's office, and they say to him, Roland says, I'm healthy. I want to give one of my kidneys to my brother, Richard. And Dr. Murray said, you know, we've been working on organ transplantation and immunosuppression and rejection. We're not ready yet. We're probably 2 years away. And they look at him and they say, but we're identical twins. Maybe the organ won't be rejected. So at that time, it was believed that identical twins had identical fingerprints. So they sent them to a police station in Boston to get fingerprinted. And while they're getting fingerprinted, there's a newspaper reporter doing another crime story, and he eavesdrops, and he writes an article. Dr. Murray is attacked by surgeons, by ethicists. What are you doing? You're going to take a kidney from a healthy person? You have no idea what will happen to that person, and you're going to put it into somebody who needs a kidney, but we have no idea whether it's going to work. You're playing God. Don't do it. Dr. Murray went ahead, this is 1954, and did the kidney transplantation. Richard, this is in the nurse's notes, has been extremely uncooperative, has knocked over infusions, has been restrained, has been moved to side room because of loud outbursts, difficult patient, erratic, unpredictable, bitter nurse on hand. Then he gets the kidney transplant, he's amazingly well. He actually lived for 9 years without immunosuppression. He married one of the nurses at the Peter Ben Brigham. They had 2 children. And Roland, the donor, lived for 54 more years. So died at 77, 1 kidney, and he and Dr. Murray became very good friends. In 1990, Dr. Murray got the Nobel Prize in Medicine or Physiology. He died a few years ago, close to 100. We had a wonderful celebration for him at the medical school, at Harvard Medical School. But when he got the Nobel Prize in medicine in 1990, he was asked again, were you playing God, taking a kidney from a healthy person, giving it to a person? You had no idea what would happen. And he gave the most beautiful answer. He said, no, all I was trying to do was save one patient's life. An amazing individual. Story is told in this publication in Science. These are the other successful milestones. 1967, the first successful liver transplant, then heart transplant, pancreas, heart and lung, living-related liver transplant, full-face transplant. And then in 2012, something very interesting happened. There's an individual by the name of Rick Rusamento. He had not ever donated blood. He goes to a gym, and he notices that the receptionist behind the counter has been missing for a month. She comes back, and he says, hey, what happened? Everything okay? She said, yeah, everything's fine. I donated a kidney to a friend. So impulsively, he goes to a local hospital, and he says, I want to donate a kidney. He never donated blood. He'd married a Vietnamese lady and adopted Buddhism. So at the hospital, I think it was here in California, they test him, and they say, we're sorry to tell you you're not a suitable match for any of our recipients. He says, I'm not a suitable match for any of your patients in your center. Why don't you take my kidney and send it to another center where I'm a suitable donor? This started what's called the kidney transplant chain. Historic record involving 60 individuals, 30 donors giving kidneys to 30 total strangers, carried out in our country over 4 months in 17 hospitals in 7 states. It wasn't the nephrologists, it wasn't the social workers, it wasn't the transplant surgeons who thought about this. It was an altruistic young man, Rick Rusamento. And this is happening more and more around our country. New York Times had a feature article about this, and other than one person who wished to remain anonymous, the others agreed to have their names and photographs in the article. The next topic is about the most common chronic infection in man. And as GI people, you all know it. More than half the world's population is infected with this organism, Helicobacter pylori. So this also is a story of serendipity. After numerous attempts to culture the bacteria, Barry Marshall and Robin Warren finally visualized bacterial colonies in 1982. They had unintentionally left their Petri dishes incubating for 5 days over the Easter weekend. They come back, they see this organism, and Barry Marshall tries to fulfill Koch's postulates. He has no symptoms, he ingests live H. pylori. He gets pretty ill. He tries multiple antibiotics. He undergoes endoscopy. He's got raging gastritis, no ulceration. And after multiple attempts, he's able to eradicate the bacteria. He then sees the light. He becomes a gastroenterologist. And he comes to our country, and then he gets the Nobel Prize in Medicine or Physiology. He's back now in Australia. This is Barry Marshall and Warren. And this is a study they published in The Lancet in 1984, unidentified curved bacilli in the stomach of patients with gastritis and peptic ulceration. Now, what's very interesting is that 100% of patients with H. pylori infection have gastritis. We were talking about our mentors at dinner last night, and I was telling you about Eli Shebel, a giant in medicine. Paul, you were there. And Eli taught me as a first-year fellow. He said, gastritis is the only itis which is not painful. The cardinal manifestation of gastritis is GI bleeding. Never make the diagnosis of gastritis in a person with abdominal pain. The rare exception is phlegmonous gastritis, a very rare disease where the stomach gets converted into a phlegmon. So more than half the world population infected with H. pylori, 100% have gastritis. They're not walking around clutching their abdomens, seeing you in consultation. Less than 10% develop peptic ulcer disease, and then a very small fraction develop gastric cancer, gastric lymphoma, or maltoma. Here's a maltoma, a patient with H. pylori. H. pylori was eradicated, and the maltoma completely regressed. So in 1910, Karl Schwartz, a physiologist, said, no acid, no ulcer. We need a certain amount of gastric acid to get duodenal ulcer disease. In fact, the overwhelming majority of patients with duodenal ulcer have twice as many parietal cells and have slightly increased acid hypersecretion. So acid hypersecretion, Zollinger-Ellison syndrome, G-cell hyperplasia, systemic mastocytosis, basophilic leukemia with hyperhistaminemia, right? Remember, there are three secretagogues. There's gastrin, there's acetylcholine, and then there's histamine. So that's a dictum to remember. And then in the last decade, we could say, no H. pylori, no ulcer. So is it pH or is it HP? Enough said about this topic. There are only basically three causes of duodenal ulcer disease: acid hypersecretion, H. pylori, or NSAIDs. If you see something else ulcerated in the duodenum, especially in the duodenal bulb, it's probably not acid peptic. Could be a hepatoma. I've seen that. Left lobe eroding into the duodenum. Hypernephroma. Or it could be Crohn's disease or tuberculosis, something totally different. So essentially, three causes of ulcer disease. Medical imaging. What a long way we've come. The first X-ray was by Wilhelm Röntgen, and he noticed that X-rays, a beam from a cathode ray tube, could penetrate solid objects, and on a film, you could produce an image. This was the first X-ray ever taken. What do you see there? A hand. What's that circular object? It's a ring. It's Röntgen's wife. It's the wedding ring. That was the first X-ray ever taken. Then we got the first CT scan image, invented in 1972 by British engineer Godfrey Hounsfield, hence the term Hounsfield units, and by South African-born physicist working in Boston at Tufts University. And they got the Nobel Prize in 1979, Godfrey Hounsfield, Alan Cormick. EMI, a company that made Electric and Musical Industries Limited, had invested in airborne radar, CT scanners, but one other entity. What was that? Recordings? No, one group. The Beatles. And they made so much money that they decided to invest further into MRI. And then Dr. Raymond Demadian developed the first MRI scanning machine. One of his postdocs, Dr. Minkoff, had his chest MRI taken, and this is the quality of the image. And now we can link gene expression and imaging traits. We're in the era of molecular radiology. And it's been done in many different fields, but particularly in primary hepatocellular carcinoma, where you can see portraits from imaging traits. We heard about artificial intelligence today and imaging. You can look at polyps and remove them, and you know confidently that this is a benign polyp. You don't even have to send it to pathology. That's going to happen very soon in our country. Contrast ultrasound, CT perfusion mapping, functional MRI, PET scanning, optical imaging. Molecular imaging of liver tumor growth. The chief of radiology at the BI Deaconess is Johnny Kruskal. He actually trained as a hepatologist in South Africa, then he went into radiology. And he's received awards by the American Radiological Society for visionary work that he's done in molecular imaging. Some of these slides, I'm grateful he's given to me. Next story is that of penicillin, also a discovery of serendipity. And there's a movie about this, The Magic Bullet. The Mold in Dr. Florey's Coat, The Story of the Penicillin Miracle by Eric Lax. So there were these soldiers dying not of wound injuries, but dying from infections. This is Alexander Fleming. He had a window in his office. He had all these Petri dishes. It was a very warm summer night in 1928. He comes back from a vacation. And again, he had not discarded the Petri dishes. And he notices that one of them, there's an agar plate of Staphylococci, and around that mold, there's a zone of inhibition. The bacteria are not growing. Now, how many of us would have taken this agar plate and tossed it, say, this got ruined, throw it? He said, no, something's happening here. This mold is producing an agent that is destroying the bacteria. So he published a paper, Antibacterial Action of Cultures of Penicillin, with special reference to their use in the isolation of influenza. But he was mostly a researcher in lysozymes. And he tried to develop penicillin. He gave up, abandoned the work in 1935. But the story moves on. And if I can have part B of the talk now. There was a brilliant German biochemist by the name of Ernst Chain. And he joins Fleury at Oxford. He escapes persecution, World War II. And they decided they were aware of Fleming's paper. It took them 7 months to find that paper. Now you would do a Google search or look up UpToDate or look up Wikipedia and get it in 7 seconds. They find the paper after 7 months. They take an experiment. They take these mice and give them fatal doses of staph. And half the mice, they give them penicillin. And the ones they gave penicillin survive. So Fleming, Fleury, and Ernst Chain got the Nobel Prize in Medicine or Physiology for this amazing discovery. The next story is that of the pill. This is a cover story in Time magazine. And it started with Margaret Sanger, who was a nurse. In Holland, she learned about diaphragms and wrote a book called What Every Girl Should Know. She started a clinic in New York. She established Planned Parenthood. She actually coined the term birth control. But she needed a chemist. Gregory Pincus had shown that progesterone could suppress ovulation. He worked with a brilliant Chinese scientist. They tested 200 compounds in animals, but they also needed a doctor. When they found a doctor in Worcester, Massachusetts, by the name of John Rock. He had signed a petition protesting the law prohibiting contraception. He was the only Catholic doctor to do so. In signing the petition, he said, always stick to your own conscience. Never let anyone keep it for you. So the pill gets approved by the FDA, but it's approved in 1957 for menstrual irregularity. And over the next several months, literally millions of women reported to their physicians with menstrual irregularity. That was the birth of the birth control pill. And there are stories about it. Malcolm Gladwell, brilliant writer, has written about it in a book that he wrote, What the Dog Saw. It was on the cover of News Vaccine. And then The Economist had a story about it. And it said, referred to women as the richer sex. It said, there is perhaps one invention that historians 1,000 years in the future will look back and say, that defined the 20th century. That invention is the contraceptive pill. Women could, for the first time, go into the labor force. They could, for the first time, decide when to have a family, when to have the next child. It's an amazing invention. There are some countries, Norway is one of them, by law, 40% of people on the board have to be women, 40%. We have boards in our country where not a single of the 20 people is a woman. That has to change. There's a wonderful medical anthropologist from Yale by the name of Helen Fisher. And she's written a book called The First Sex, The Natural Talents of Women and How They're Going to Change the World. I'm very proud to have two daughters, and even more amazingly, two granddaughters, who are a total joy and inspiration for me. Next story is that of the pacemaker. This is also a story of Boston. There's so many stories in cardiology. I've chosen this one. And this is Beth Israel Deaconess Medical Center and a legend by the name of Dr. Paul Zoll, a very diminutive man. I met him when I first joined the BI 35 years ago, and he still had a lab in the basement of one of the buildings called the Kirstein Building. So this was what was happening during the war. Soldiers getting shot, and when they would remove the bullets from the chest near the heart, they would notice the heart was very excitable. He developed the first telemetry unit. That's the Beth Israel Hospital. Now there are two hospitals, Beth Israel and New England Deaconess, merged, Beth Israel Deaconess Medical Center. That's Herman Blombach, one of the first chairs of medicine at the Beth Israel, an eminent cardiologist. So there was this 65-year-old man with severe heart failure, incapacitating angina, high-degree AV block. Zoll applied what he called an external stimulator via a needle that he put in the chest, in the heart. And for 5 days, the patient maintained a paced rhythm with good cardiac function. But that's the pacemaker on that, and the nurse is pushing it. He wrote a single-author paper in the New England Journal of Medicine, Resuscitation of the Heart in Ventricular Standstill by External Electrical Stimulation. With such a machine, it should be possible to defibrillate the human heart. Again, the paper was criticized as against the will of God. These people are dying. What are you doing? Bringing them back to life. He invented the AC defibrillator, used cardiovation to treat SVT and AF, and started the first telemetry unit. This is Paul Zoll. He died in 1999. There are many, many amazing stories in cardiology. I will briefly mention one other one at the end. Smallpox, eradication of that in 1980 was a major milestone in the last 100 years. But then we knew about polio, and then a new epidemic emerged, AIDS, two modern plagues. Polio, you see this amazing picture. This is in Egypt, and if you notice carefully, the right leg of that individual is withered, and he's using a cane to walk. This is polio. We had these iron lung machines, and the decision had to be made, are we going to invest more in iron lung machines, or are we going to try and develop a vaccine? And here's where the story turns to one of our presidents, who had polio. He hid it from the public for many, many years successfully. He'd be propped up on the podium to give a talk. And then finally he said, you know what? I'm going to be open about it. He'd be in a wheelchair. Here's a young girl, infantile paralysis. Remember that term? Polio in children. And then they got a hold of Eddie Cantor, and they wanted to do fundraising. And Eddie Cantor came up with a brilliant idea. He was a comedian. The March of Dimes. People in America started mailing in envelopes dimes to the White House. It was the first true public funding program, crowdfunding. And millions of dollars poured into the White House. So then they had this event, join the March of Dimes, National Foundation for Infantile Paralysis. And as you know, FDR has been honored, and every dime, March of Dimes, has his picture. John Franklin Enders entered Harvard to study English literature, Germanic, and Celtic languages, but he became friends with medical students. And he said, you know what, I'm going to get a PhD in bacteriology and immunology. And then with Frederick Robbins and Thomas Weller, developed tissue culture method to grow viruses. Thomas Weller's son, Peter Weller, is our chief of infectious disease at the Beth Israel Deaconess Medical Center in Boston. He's an ID expert, expert in parasitology. So they wrote this paper, Cultivation of the Lansing Strain of Poliomyelitis Virus in Cultures of Various Human Embryonic Tissues, published in Science in 1949. And then they got the Nobel Prize. Three of them, Thomas Weller, Frederick Robbins, and John Enders. Now we have the Sabin and the Salk vaccine against polio. Jonas Salk, Albert Sabin. Elvis Presley promoted vaccination. He got the polio vaccine, and here he is, smiling as he's doing that, so that people would not be concerned about getting the vaccine. And virtually eradicated a few hotbeds in a few parts of the world, including Pakistan. But then a new epidemic emerges. And when it happened, we were all scared. I remember as a gastroenterologist, every day that hepatologist, every day, multiple consults from the wards. Wards full of patients with AIDS cholangiopathy, with abnormal LFTs, with jaundice, with diarrhea, with malnutrition. 1981, 5 patients with opportunistic infections were described in MMWR with no identifiable cause. All were men having sex with men. All had pneumocystis carinii, then name changed. None had cancer. And at that stage, they appeared reasonably nourished. And then another report. Michael Gottlieb said, I knew I was witnessing medical history, but I had no comprehension of what this illness would become. Elizabeth Taylor was a good friend and promoted research into AIDS and did a lot of fundraising. No one could imagine. By 2007, 33 million infected worldwide, 7,000 new cases a day, 55 million people had died from AIDS by 2007. 1983, a T lymphotrophic retrovirus isolated from a patient with lymphadenopathy at the Pasteur Institute. A year later, demonstrated to be causative of AIDS. A year later, ELISA assay developed. A year later, AZT, a drug on the shelves, found serendipitously to raise the CD4 count. And then 1996, heart era begins. This is AZT, shelved because of limited activity against tumors in mice, first synthesized in 1964. And then the first trial showing AZT increased CD4 count, published in The Lancet in 1986. And then Scott Hammer, who trained with us at the Beth Israel, then he moved to New York, reported the first trial of combination treatment resulting in a decrease in mortality. And that was a landmark paper. And then many, many other novel drugs developed, at least 25. There were patients who would have to count all the pills they had to take to suppress HIV, take it multiple times. Now we have one pill, and they can take it. Nothing tells the story better than a picture. This is a young kid dying of AIDS, and now perfectly healthy with suppression of HIV. Of course, we can't talk about the top stories in medicine without talking about insulin. Banting and Best. So Charles Banting is a surgeon, and Frederick Banting, and I think Charles Best is a medical student. So he goes to McCormick, a professor of pathology, and he says, I need a few dogs, I need a lab, and I need a medical student. And the chief of surgery says, I'm going on vacation. You can have my lab, I'll give you 6 dogs, and you can have 2 medical students. He says, no, I just need 1. So 2 medical students show up, they flip a coin, and Best wins. And the other guy takes off and goes for vacation to Europe. And they remove the pancreas of the dogs, and they notice that the dogs have severe polydipsia, polyuria, and when they're peeing, the fleas are coming and swarming on the urine. So they test it, it's full of sugar. They said, the pancreas makes something that prevents the blood glucose from elevating. This is a young lady. We used to starve them, and they would live a few years. And then insulin came around, and she survived. We have a patient at the BI, Jocelyn, who's now 93, and she has type 1 diabetes. She's been taking insulin for almost 80 years. Pretty remarkable story. Estimates show there are more than 15 million diabetics living today who would have died at an early age without insulin. Many other stories. The one tragedy for me about insulin is that when they gave the Nobel Prize, they gave it to MacLeod and Banting. And Banting was incensed. He said, Best deserves the prize. He shared half his Nobel Prize money with Best. And then Banting and Best, they were at the University of Toronto, never wanted to make money from this discovery. They sold the patent for insulin to the University of Toronto. You'll be astounded if you don't know it. For $1. $1. And now penicillin is so expensive, and there's a rebellion by patients and endocrinologists about that. There's so many other stories. Artificial prosthesis. I'm a fortunate recipient of 2 artificial hips. I travel, I give talks, I play golf, I see my grandkids. I'd probably be in a wheelchair if this was 40 years ago. Discovery of Lyme disease, aspirin. We know about it preventing colorectal cancer. There's a recent study, low risk of primary liver cancer. Recent study, progression in NASH, least if people are on aspirin. Of course, heart attacks and stroke, we know that. Lyme disease, a new disease. Other top stories, advent of placebo-controlled double-blind randomized trials. But also the first cardiac catheterization by Werner Frossman. He was 25 years of age. He's sitting at a pub, and he tells the person after he's had a few beers next to him, he says, I think it's possible to take a catheter, put it through the radial artery, get it into the heart, measure blood pressure, pulse. Before that, it was thought if you put a foreign object in the heart, there'll be ventricular standstill and you'll die. So he goes to work, he's a doctor, and he convinces one of the head nurses in the surgery unit to catheterize him. And she says, I'll agree, but you have to catheterize me. He fools her into thinking he's catheterizing her. He sedates her. Meanwhile, he's catheterizing him. She's handing stuff to him. Finally, he thinks the catheter is in the heart, and they decide to go get an X-ray. The X-ray machine is on a different floor. They get into the elevator. Radiologist gets in. He looks at this guy. He goes berserk, tries to yank the catheter. They push him into a closet, lock it. He goes, gets the X-ray, and it's 2 inches away, threads the catheter further, does the first angiogram, cardiac catheterization on himself. Some 27 years later, age 52, by some accounts, he's at the same pub, and his wife calls him and says, there was a call from Stockholm. He says, crank call, hang up. He comes home, he goes to sleep. The next morning, there's another call. He got the Nobel Prize in medicine or physiology. His chief actually was so incensed, he wanted to throw him out. But he said, this guy did something remarkable. He was ostracized because he joined the Nazi party. But pretty remarkable. The first cardiac catheterization ever done on a human being was done by this young man on himself. Now, I'm very, very concerned, like all of you are. We talked a little bit about this last evening at dinner, about burnout, about resilience, about how medical students are committing suicide. One of our surgeons at Harvard did a study. 60% of third-year medical students in our country are expressing elements of burnout. They haven't even joined the profession. What are we doing? Is it the system? Is it our own personal resilience? We need to address both. We also need to study those who are not burnt out. If you study emergency room physicians and 45% are burnt out, what about those 55% who are not? What is their secret? Is it friends? Is it self-care? Is it meditation? Is it hydration? Is it exercise? Is it vitamin D? Who knows what it is? We need to study that. The other thing I tell my colleagues, and I say it very politely, is when you're sitting to hear a talk at Grand Rounds or you're sitting in the hospital cafeteria, for God's sake, don't complain. Don't talk about the electronic health record and how it's changed our lives and how we're miserable. The students are sitting next to you, the intern's resident. It rubs off. Tell stories. Talk about discoveries in medicine. Tell the story of the baby that was born twice. How many of you have heard this story? It's a really remarkable story. So this couple has difficulty conceiving. And finally, this woman gets pregnant, and they're ecstatic. Week 16 ultrasound, they go in, and the ultrasound technician is very quiet. So she can sense there's something wrong. And then the technician says, I'm going to go get the obstetrician. The obstetrician comes, he looks at the ultrasound, he says, I'm sorry to inform you, there's a gigantic tumor in the tailbone of the spine. It is the same size as the rest of the fetus. The heart is beating at twice the rate. Half the blood supply is going to this tumor. The heart is going to conk out. Recommend an abortion. This is sacrococcygeal teratoma. It's benign, but it's huge, gigantic. So they leave. They go to Google, and they find a Texas Fetal Heart Institute. And they go there. There's an obstetrician. He says, we can try something. So they give permission. He assembles a team, including a neonatal cardiologist. So he takes her to the operating room, makes an incision in the abdomen and the uterus, pulls out the fetus, removes 90% of the sacrococcygeal teratoma, cardiac arrest. The neonatal cardiologist resuscitates, heartbeat comes back, pushes the fetus back into the womb, sutures it. All the amniotic fluid has drained out. They have figured out synthetic amniotic fluid. What is the right pH, chemistry, glucose, sodium? Takes a syringe, injects it, no leakage. Survives to 37 weeks, delivered by C-section, perfectly healthy baby. Lindley Bomer. Beautiful young girl. Hence the term baby that was born twice. Came out of the womb, went back into the womb, came back. So I hear this story. I'm driving early to work on NPR, and I pull over. I said, I got to listen to this story. I don't want to be distracted. And the interviewer turns to the doctor, and he says, what happened? He says, oh, she's the most beautiful girl in the world. He says, have you ever done it before? He says, yes, once. Meanwhile, thousands of obstetricians from all over the world have now trained with him by video or by Skype or whatever, and they're learning the technique. So he says, yes, I did it once before. He says, when? He says, 6 years ago. So what happened? He says, oh my God, she's the most beautiful 6-year-old girl in the world. She recently performed in school, did a recital. Her parents invited me. I sat in the front row. She came and she sang, and he said, I had tears streaming down my cheek. It's not the same scale as penicillin, hepatitis B, insulin, first X-ray, but it's an amazing story of our profession, of courage, of fortitude, of grit, of compassion, of love. We need to share more of these stories. So now I'll predict the next 50 years. It wasn't Woody Allen, it wasn't Yogi Berra who said predictions are hazardous, particularly those about the future. It was Niels Bohr, Nobel laureate in physics. He said prediction is very difficult, especially if it's about the future. So here are some predictions. There will be vaccines to prevent Alzheimer's, malaria, TB, HIV, Hep C, Ebola, enterovirus 868, and many cancers. Regenerative stem cells will replace organ transplantation. Bariatric surgery will become a historical footnote. Right now, it's the #1 general surgical procedure at the hospital I work at in Boston, at Tufts Medical Center. Imaging technology and biomarkers will enable early identification and aid in eradication of tumors. Immunotherapy will be the key to cancer treatments and cut cancer mortality by over 50%. We will look back and say, my God, radiation, chemo, what were we doing to our patients? Democratization of knowledge will occur. Supercomputers will allow citizens to access health information. Non-invasive sensors in our clothes will monitor a ton of information. Personalized or precision medicine will become the norm. Nanotechnology and nanobiomedicine will flourish and permit more precise diagnosis and targeted therapies. There will be a greater scientific understanding of the role of the gut microbiota. This is the next talk I'll give, leading to novel therapies. Explorations of the workings of the brain and consciousness will be undertaken and will provide masterful insights. Social and political changes will have a major impact in addressing health on many frontiers. Healthcare will be available and affordable for all US citizens. Primary care medicine will be celebrated as the hero's profession. Patients will take a pill that will mimic exercise. This was given to me by Barbara Khan. She was our chief of endocrinology, an absolutely brilliant woman. So I sent an email to all the division chiefs. I'd come up with about 10 or 12 of these, and I sent an email to all the division chiefs in the Department of Medicine at the BI, and I said, in your particular field, tell me what will happen. And she said this. So I said, Barbara, do you have any references? She sent me 4 references, 3 articles and an editorial she had written. So in a mouse, you can create a mutation, and this mouse can be on the treadmill for 3 months, nonstop. It's been dubbed the mighty mouse. So we may have a pill, and life expectancy in our country will exceed 110 years. But don't forget why we went into this profession. It was not only, as Francis Peabody said at Harvard, for the care of the patient, it was for the caring of the patient. And together with nurses and pharmacologists and nurse practitioners and peers, we will make a huge impact in the future. Denmark is one of the happiest countries in the world. There are many reasons, but I learned recently that from age 6 to 16, when you go to school, every week there's a mandatory class, and the topic is empathy. Mandatory. We should teach it all over the world. We need to be more kind. So thank you very much for your attention, and I look forward to chatting with you and learning from you. Thank you.
We have time for questions. Thank you, Dr.
Sure.
Chopra. That was just an inspiring talk and a great overview. I'm sure there are going to be many questions.
Share a story. Okay.
I'll try to say something. When I was a student, and then when I was an intern at Beth Israel, one of the very old gastroenterologists, he said that when he was a student in Moscow, there was a cholera epidemic in Siberia. The Tsar sent all the medical students to Siberia, and their job was to sit next to a patient and keep making them drink, and they survived. And he said he was so inspired that as a student, he could save a life by just making them drink.
Oh.
And so he became one of the gastroenterologists at BI.
Was it Lou Zetzel?
Yeah.
Yeah, awesome. Thank you for sharing that story. Okay.
Speaking of Russia, I went to medical school in Moscow in '82. In '86, I was sitting at the infectious disease lecture, and the professor told us the story that I want to share with you. There is a disease in the United States of America, the worst country in the world, and it will never happen in this country, our beautiful country called Soviet Union. I'm talking about the AIDS. It's crazy.
Hi, when Brooke Blumberg came to give a talk at UCSF, there was a huge riot because they felt he was experimenting with human beings. And of course, you know, he was at that place on Staten Island, and all the kids would either come in with hepatitis B or non-A, non-B, now C, or they would get it while they were there. So it was
I'm
terrible.
I'm glad you bring that up, because we as physicians have been guilty of some of the worst things. And it wasn't just the Nazi physicians experimenting on innocent Jews and even children. We were doing it. Willowbrook, giving hepatitis to people with Down syndrome. There were physicians who advertised for Lucky cigarettes. Said, if you smoke Lucky cigarettes, it'll be healthy for you. It will improve your breathing and your tolerance for running. And we knew it wasn't true, but we were doing it. So there are many stories out there that show the dark side of what we as human beings did. But luckily now I think there are better safeguards. It's still happening. There are countries, including China, where they execute prisoners and they harvest their organs for transplantation. One of my colleagues, a transplant surgeon at the Beth Israel, started a petition, and I think it's true now, that hepatology will not, the journal, will not accept a single paper on transplantation from China. So it's still happening around the world. People are experimenting and killing people to publish.
Back in the 1960s, I did some of my training at Maimonides Medical Center in Brooklyn, and had the good fortune of having some of my training with William Dressler, a cardiologist who came to the United States from Germany during the war. William Dressler had the most incredible ability to do physical diagnosis, and was able to see a patient in the bed, look at the patient, and determine whether he had dextrocardia or not. Was able to percuss the heart and replicate the size of the heart, left atrium, left ventricle, and then match that to an X-ray without having seen the X-ray beforehand. My wife's grandmother was admitted with congestive heart failure. She was in her mid to late 80s. And I asked Dr. Dressler to see this relative, and he spent about an hour with a history and a physical. And at the conclusion of this, in this woman in her late 80s, said that she had a ventricular septal defect. Her cardiologist said, well, Dr. Dressler's a nice man. He's getting on in age, and that can't possibly be true on history and physical exam. Well, she passed away about a year later, and a limited autopsy of her heart disclosed a ventricular septal defect.
Yeah, amazing. Thank you for sharing that story. How much time do we have? 2-3 minutes? So I'll quickly share two stories. One I recounted last night at dinner to friends. Eli Schimmel, chief of gastroenterology at the Jamaica Plain VA. I did my fellowship with him. And the very first day, there are 5 fellows, and I'm going to present a case. So I put up the plain X-ray on the view box. I'm about to flick the light off. He says, Sanjiv, keep it on. He looks at it for a minute. Then he says, there are 5 things wrong with this patient. I said, okay, Eli. He said, he's a chronic smoker. So I'm not impressed. It's a veteran, hyperinflated lungs, depressed diaphragms. He says he's a chronic alcoholic. I'm not impressed. Chronic calcific pancreatitis. Then he says he needs his gallbladder out, which is the reason I'm presenting. There's a little sliver of calcification in the right upper quadrant, porcelain gallbladder, up to 60% risk of gallbladder cancer. Then he says he has diabetes. I said, Eli. I turned to the other 4 fellows. I said, which one of you has already presented this case? He said, no, Sanjiv, you saw the case. I said, Eli, how can you tell he has diabetes? He said, look in the pelvis. There's calcification of the vas deferens. If you see that in the West, it's diabetes. If you see it in a developing country like India, it's tuberculosis. And he says the fifth thing, he had polio as a child. I said, what? I took that history. He had polio as a child. I said, how can you tell from the KUB? He says, look at it. Aseptic necrosis of the head of the femur and kyphoscoliosis. That combination is polio. So they're giants in medicine, and we're losing the art of observation, inference, history taking. And some people are trying to resurrect it. We do rounds on physical diagnosis at the Brigham. I do it with about 20 of my colleagues, one-on-one with the chief residents, who then go and teach it to the rest of the house staff. And I'll conclude by telling you the reason I went into medicine. I was 12 years of age, playing a cricket match in India on a hot, sultry weekend. And Sunday evening, around 6 o'clock, I'm not feeling well, and I take a nap. And about 30 minutes later, I wake up, and I'm terrified. I can't see. I'm blind. So I nudged my brother. I said, Deepak, I can't see. And he must have done visual thread and reckoned I wasn't faking it. He started to cry. I have one brother, and he's turned blind. We were staying with my uncle and aunt, going to St. Columbus High School, arguably the #1 school for all boys in India, Irish Christian brothers. My dad was a cardiologist, brilliant, but he was stationed 300 miles away. They wanted our schooling to finish in Delhi. So they take me to the military hospital, and the doctors examine me, including, I believe, an ophthalmologist. And they don't have the foggiest idea. There's talk about hysterical blindness. I'm a happy kid. I'm a good student. You can come from the side with a sharp object, and I'll blink if I'm faking it. Finally, they get a hold of my father. By the way, he could tell the PR interval on EKG by listening to your heart. He made the diagnosis of Wilson's and Whipple's and all kinds of neurological disorders, just somehow knew it. So get a hold of him. This is 1961. He's in an army jeep. And very calmly he says, tell me everything that's happened to Sanjiv in the last 2 months. I said, he's been fine. He says, no, I need to know everything. Any injuries, any meds? Oh, yeah. He had a laceration to his right leg with a sharp object. 6 days ago, he was taken to the casualty ward, got stitches. Did he get an antibiotic? So they look in the records and mention it. He said, did he get a tetanus shot? And very proudly they said, yes, we gave him a tetanus shot. He asked one more question. What kind of tetanus shot? Anti-tetanus serum, ATS, or anti-tetanus toxoid, ATT? So they looked in the records, they said ATS. I have no idea how my father divined it. He said, Sanjiv is having a rare idiosyncratic reaction to the ATS. It occurs less than 1 in a million. He has a localized form of serum sickness only affecting his 2 optic nerves. They're ready to burst. Start an intravenous and give him massive doses of corticosteroids. And that was done, and about 10 hours later, my vision returned. And the next morning, I said, you know what? I want to be a doctor like my father. I've told this story to professors of ophthalmology at UCLA, at Stanford, at Duke, at Mass Eye, and they go, what? How did your father know that? It was probably not even a footnote in the textbooks of their time. But I tell that story to talk about the art of history taking, art of physical diagnosis, just like you mentioned. Dressler was Dressler's syndrome, post-MI, pericardial syndrome. Yeah. Thank you. Okay.